Adrenal gland part 2, CT and the ultrasound imaging technical points, clinically based questions. After each question, you can pause the video to give a chance for thinking. This video aims to know the principles of CT and the ultrasound imaging protocols and the assessment of the adrenal gland in different case scenarios. Question number 1. A female neonate refers to the radiology department for suspicious adrenal hemorrhage. Which modality is the initial modality of its choice in such a case scenario? Non-contrast CT, T1 and T2 with fat suppression MRI sequences, plain X-ray, or ultrasonography? The answer of that question is choice D, ultrasonography. Ultrasonography is considered the initial modality in neonates, as the gland is larger in size at birth. With growing up, the gland shrinks in size. That makes it difficult to be identified by ultrasound in adults. Question number 2. In the previous case, the adrenal glands were normal by ultrasound. What are the characteristic sonographic findings of the normal adrenal gland? It has an echogenic central region and peripheral hypoechoic zone, or it has a hypoechoic central region and a peripheral echogenic zone, or it has an echogenic central and peripheral zones. These are images of normal neonatal adrenal ultrasound. We can notice here the central region is echogenic while the peripheral region is hypoechoic. The trick of that question is to remember which is echogenic and which is hypoechoic. Question number 3. Male patient 21-year-old with suspected adrenal function had normal serum creatinine and 2 previous unenhanced CT examinations after extracorporeal shock wave lithotripsy within the last 2 weeks. Which imaging approach is the best for the assessment of the adrenal gland? Ultrasound, CT adrenal protocol, MRI with chemical shift sequence, revision of the old CT studies. The answer of this question is a choice D, revision of the old CT studies. If we revise the case scenario, we'll find that the patient had recent CT studies within the last 2 weeks. And this is a useful point. We can use it because non-contrast CT can give us a useful information about the attenuation value of a possible adrenal lesion if it is present. So, attenuation value on unenhanced CT is a significant predictor for adrenal lesion characterization, and we will discuss these points in the next cases. So there is no need to move to another imaging modality like MRI or CT with contrast unless we revise the old CT examination and we confident that there is a suspicious adrenal lesion. Additionally, ultrasound is not a suitable modality in adult patients as we have discussed in the previous cases. It could be useful in the neonatal age. Question number 4. In the same case of number 3, the radiologist has revised the previous CT studies and found 2 cm right adrenal lesion. The attenuation value of that lesion was 8 Housenfield unit. What's the best next step? CT with contrast adrenal protocol, MRI study, no needs for further assessment, biopsy. The answer of that question is choice C. No need for further assessment. Why? There is a golden rule: an adrenal lesion that measures less than 10 Hounsfield field unit in an enhanced CT is a characteristic of a benign adrenal mass, and no further imaging evaluation is required. Question number 5. A 60-year-old male with a history of colon cancer, adrenal mass about 3 cm was discovered at the right adrenal gland. The previous images were not available for comparison. The radiologist has decided to do CT adrenal protocol for more characterization. So what's the best choice that can describe this protocol? This protocol has a pre-contrast and post-contrast 1 minute delay, or it has pre-contrast and 10 minutes delay, or it has a pre-contrast and post-contrast 1 minute delay and 15-minute delay, or this protocol has a pre-contrast, arterial, venous, and delayed phases. The answer of this question is choice C, where CT adrenal protocol has 3 phases: unenhanced CT, and 2 phases post-contrast, 1 minute delay and 15 minutes delay. And this protocol is designed for characterization of adrenal lesions, especially differentiating adenomatous from non-adenomatous lesions. Through this protocol, we can calculate 2 famous equations, absolute and relative washout equations, which can characterize the adenomatous lesions from non-adenomatous lesions, as we will discuss this in the coming cases. Question number 6. Regarding the formula of absolute washout of adrenal CT protocol, which cutoff value can diagnose a lesion as a lipid poor adenoma? 60%, 55%, 16.5%, or 40%? The answer of this question is choice A, 60%. 60% or more is considered a highly sensitive and specific cutoff value for differentiating adenoma from non-adenomatous lesion when using absolute washout equation. The formula of the absolute washout, as shown here, based mainly on calculation of the difference between housing field unit in the different cases of the CT study. But remember that to apply the washout, either absolute or relative washout, you should have a homogeneous mass lesion. That is to say, there is no calcification or hemorrhage or cyst or central breakdown. Otherwise, you will get an inaccurate results. Question number 7. Regarding the formula of relative washout of adrenal CT protocol, which statement is true? Please choose the right answer. The answer of this question is choice B, and we can realize that the equation doesn't contain the value of housing field unit in unenhanced phase of CT, and this is simply because of relative washout is usually used when unenhanced phase of CT was not obtained. 40% or more is a cutoff value of the relative washout for differentiating adenoma from non-adenomatous lesion. Also, it has a high sensitivity and specificity, especially when the mass is homogeneous and less than 4 cm, provided that there is no other risk factor for such mass. Finally, take-home message. In adult patient, CT adrenal protocol is commonly used to detect and characterize adrenal lesions. The standard CT adrenal protocol is composed of three phases: ideally pre-contrast, post-contrast 1 minute, and 15 minutes delayed after contrast administration. An unenhanced attenuation value of an adrenal mass less than 10 Hausenfeld unit, it is diagnostic of benign lesion and no need for further management. The calculation of absolute washout and relative washout formula as shown here. Remember that in a standard scenario, absolute threshold values of 60% or more and relative washout threshold of 40% or more have been found to be high sensitivity and specificity equals to 98 and 92 respectively for diagnosis of adrenal adenomas. Remember also, ultrasonography is the initial imaging modality in neonates but not in adult patients. The normal sonographic findings of adrenal gland is centrally echogenic and peripherally hypoechoic. Thank you and see you in the coming video.